The presentation is reference Ontro 01 PHCC. And the title of the presentation is Primary Healthcare Charter, Understanding the Core Values and Conceptual Framework. It is a learning management system called the PAC Online Training Outreach that is operated by Isha Limited, which is Abuja, Nigeria based. There is a dilemma. We have promoted, we have seen, and felt the practice of primary healthcare over 30 years in Nigeria. Recall that primary healthcare program was launched in 1986 under the leadership of late Professor Olukoyede Kuti as the Minister of Health. Yet we are still struggling for good results. Why the dilemma? We know that a good, really pretty good primary healthcare should be, but the challenge is that we don't do what we should do to get good results. Why don't we do what we ought to do? There are many reasons why we don't do what we ought to do to get good results. My opinion is that many a times we don't know what to do because of limitation in know-how and skills. Not getting good results is not necessarily a matter of limited resources. Creating onto program is a talking contribution towards building necessary understanding of what we can do. What are the learning objectives? Understanding the basic concepts in primary healthcare approach is very, very fundamental. And understand why PAC is considered a philosophy, describing the PAC conceptual framework, describe how the conceptual framework determines the shape and direction of primary healthcare processes, and also describe how the conceptual framework determines the outcomes in the primary healthcare approach. What we know, there are some basic and fundamental facts that we know. Access to primary healthcare is the foundation of good health. Primary care is a major determinant and driver of a nation's health outcomes. PAC remains an important force in thinking about healthcare in both developing and developed countries. If we apply democracy lens, primary healthcare could be rationalized as health of the people, for the people, and by the people. In many countries, the primary healthcare system is the cornerstone and the hub of health system. It is not different from Nigeria. Over the years, primary healthcare system in Nigeria had remained grossly inefficient and ineffective. There has been systematic weaknesses due to operational gaps ranging from weak and ineffective policies, infrastructural decay, inadequacy in human resources, essential drugs, and other supplies and logistics. Lack of sufficient progress in the attainment of MDGs, particularly MDGs 4 and 5 in many countries, was attributed to weak PAC system. Today, universal healthcare coverage has evolved as a powerful concept in public health. The existence of a well-functioning health system in the timely access to services is critical for attaining universal health coverage. There can be no universal health coverage without primary health care. Attaining universal primary health care, attaining universal health coverage is not just an option, but a necessity. The primary health care charter. If there's anything in the health sector that is dominant and have survived for many years, it is the primary health care charter. The background. Let's recall the historic international conference on primary health care held in 1978 in Alma-Ata in the defunct Soviet Union. It was the first attempt to unify thinking about health within a single policy framework. Primary health care was adopted as a philosophy for addressing the challenges in health development. Primary healthcare is a model for building health system that would address inequity and inequality in health outcomes. The resolutions agreed at the conference constitute what we know as the Primary Healthcare Charter, and the overall outcome of the conference is what is known as the Alma-Ata Declaration. Alma-Ata Declaration represented a shift in global health policy with commitments to address inequity and inequality in access to healthcare as well as the health status of the people. Since Alma-Ata, many countries have been working towards the goal of health for all. However, despite the prospect of primary healthcare, many developing countries continue to suffer the greatest burden of diseases. The health systems remain too fragile to cope with the health needs of the majority of the people. There are persistent challenges in PSC development. However, PSC is continuing relevance and renewal efforts are ongoing. The global community still believes that primary healthcare approach is more relevant today than ever. Therefore, primary healthcare rebirth has become inevitable. There is a global momentum to renew primary healthcare with costs echoing at international, regional, and national conferences. At the global stage, the World Health Organization set the tone for PSC renewal with the World Health Report in 2008. It was Christian primary healthcare now more than ever before. And in Africa in 2008, there was the Ouagadougou Declaration on Primary Healthcare and Health Systems in Africa. Achieving better health in Africa is the new millennium. The objective of the declaration was to review the past experiences and refine strategic directions based on 9 priority areas, which has become a keystone for developing countries' strategic plans in Africa. As part of renewal effort, there has been international conferences on the 30th and 35th anniversary of the Alma-Ata PSC Declaration held in Almaty City in Kazakhstan to further reinforce primary healthcare ideology. The philosophy corrects in primary healthcare. There is a PSC is a social strategy concerned about addressing ethical issues and political issues. The ethical issues include the issues of inequity and inequality, while the political issues include PSC financing arising from healthcare, both of which are central to philosophy. It also recognizes that social conditions as the most single important determinants of good health. It represents an idealistic health model with the understanding of health as a well-being rather than the absence of disease. The key phrases in the definition of primary healthcare. Essential healthcare. Primary healthcare is vital and indispensable to addressing common causes of morbidity and mortality in the countries. It's based on practical, scientifically sound, and socially acceptable methods and technologies, meaning it is based on rational and logical techniques and procedures, and not based on voodoos, witchcraft, or mysteries. Primary healthcare is made universally accessible to individuals and families in the community, meaning it brings healthcare as close as possible to where people live and work, and is based on community involvement and participation. In primary healthcare, the people are central focus and are actively involved in the planning, implementation, and management, including monitoring and evaluation. The people should own and drive primary healthcare. There is also the issue of spirit of self-reliance and self-determination. This element is the key to sustainability. Primary healthcare is based on the cost that the community and country can afford to maintain at every stage of their development. It is the entry point into the health system. Primary healthcare is the first level of contact of individuals, the families, and the community with the national health system. Continuing healthcare process. PSC is not a system of healthcare, but part of the nation's health system. It constitutes the first element of a continuing healthcare process. The primary healthcare approach is a means of achieving health for all and ensures equitable access. What are the challenges? Several years after launching primary healthcare, health outcomes are still understandably low in Africa, in Nigeria, and across much of the developing countries. The persistence of deep inequities in health status is a problem for which no country in the world is exempt. Much of the burden of disease can be prevented or treated with non-high impact and affordable interventions and technologies. At the center of this human crisis is the failure of the system. What are the fundamental issues in primary healthcare approach? These are often honored more in breach than in observance. There are underpinning highly relevant and reference core issues that are central to primary healthcare. The issues have become widely shared social expectations for healthcare development in general. The issues have been clearly articulated in the Alma-Ata Declaration and several publications thereafter. The first thing is that primary healthcare as a national policy trust. It is recommended that countries make strong and continuing commitment to primary healthcare at all levels in the spirit of social equity, which is aimed at improving population health. It is also recommended that primary healthcare is adopted as the foundation of national health system, and health systems to be organized to support primary healthcare and make it more effective. It is recommended that countries should establish national strategies for primary healthcare to translate policies for primary healthcare into action. It is also recommended that governments articulate national strategies with well-defined goals and implementation of plans of action to ensure that primary healthcare is made accessible to entire populations, particularly the underserved communities. It is recommended that governments routinely reassess policies, strategies, and plans, and they ensure their adaptation to evolving stages of development. It is recommended that nations reorient their existing systems to ensure that all levels of health systems support primary healthcare by facilitating referral of patients. It is recommended that nations provide supportive supervision and guidance, logistics support and supplies, and the improved use of referral facilities. PAC elements addresses the main health problems in the community. It provides promotive, preventive, curative, rehabilitative services and emergency care appropriate to meet the main health problems in the community. PAC is an integral part of a comprehensive national health system, and included all activities that contribute to health at the interface between the community and the health system. In order to make primary health care to be comprehensive, all development-oriented activities should be interrelated and balanced so as to focus on problems of the population. Comprehensive means that culturally acceptable, technically appropriate, and appropriate selected intervention should be implemented in combinations that meet the local health needs. This implies that single-purpose or vertical and selective programs should be integrated into primary healthcare activities. There should be the issue of functional linkage to be sustained by integrated, functional, and mutually supportive referral hospitals. And what is the content? Primary healthcare focuses on the main health problems in the community. It recognizes that problems and the ways of solving them will vary from one country and community to another. And the components of primary healthcare includes the first traditional 8 components, which includes education concerning prevailing health problems and methods of identifying, preventing, and controlling them, promotion of food supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health care, including family planning. immunization against the major infectious diseases, prevention and control of locally endemic diseases, the appropriate treatment of common ailments and injuries, provision of essential drugs. Others outside the traditional health components are promotion of mental health, oral health, primary health care, and care of the elderly. Now, what are the principles of primary health care? These are what we call the core values, and there are 5 of them. The first is universality and equity, community participation, multi-sectoral collaboration, appropriate technology, partnership, and collaboration. Universal access and equity is at the center of primary healthcare approach. PSA approach reduces the gap between the haves and have-nots in relation to access to healthcare and results in equity. Through policies aimed deliberately at allocating greater resources to or protecting the underserved and vulnerable groups, such as mechanisms like exemptions and deferment. There is the community participation component. Primary healthcare is predicated on full and organized community participation and ultimate self-reliance, with individuals, families, the communities assuming more responsibility for their own health. Community participation in the recognition and solution of health problems can be facilitated by support from stakeholders who can be governmental, non-governmental, as well as by accountability to the people. Community participation can be facilitated through effective propagation of relevant information and the development of necessary institutional arrangements, such as the committee system of health development committees, through which communities can be mobilized to assume responsibility for their health and well-being. It is recognized that people have the right and duty to participate in the process for the improvement and maintenance of their health. There is also the multi-sectoral collaboration as a key issue. Primary healthcare is an integral part of socio-economic development. This we must understand, and the close interrelationship and the interdependence of health and socio-economic development must always be considered. The activities of health sector must be coordinated at national, intermediate, and community or local level with those of other social and economic sectors, such as education, agriculture, water resources, housing, public works, communication, and in industry. Health activities should be undertaken concurrently with measures such as those for the improvement of nutrition, particularly of mothers and children, the housing, employment, protection, improvement of the environment, equitable distribution of resources, and poverty mitigation measures. There is the appropriate technology component. Primary healthcare requires the identification and use of technologies and methods that contribute to health and scientifically sound, adapted to local needs, and accepted to the people, and are maintained by the people themselves in keeping with the principle of self-reliance with the resources the community and the country can afford. Appropriate health technology that people can use and afford include adequate supply of low-cost, good quality essential drugs, vaccines, biologicals, and other supplies and equipment, as well as functionally efficient supportive healthcare facilities, such as health centers and referral hospitals. There is also the collaboration and partnership. Primary healthcare recognizes the role of partnership with international organizations, both multilateral and bilateral, and non-governmental organizations and other key partners in health development. It recommends that partners should give technical and financial support with full respect for the principles of national self-reliance and self-determination and maximum utilization of locally available resources. Partners should encourage and support national strategies and plans for primary healthcare as an essential part of overall development. They should also play a key role in the formulation of plans of action at the regional and global levels to facilitate the mutual support of countries and mobilize other international resources for accelerated development and sustainability of primary health care. The 4 layers of PSC development framework. The conceptual framework for primary health care recognizes 4 layers, and all countries have political, administrative structures consisting of 3 hierarchical levels: the central, intermediate, and local levels. Our PSC development framework is people-centered and community-based. It fits this hierarchical arrangement and facilitates linkage between primary health care and socio-economic development. The first layer is the community-based initiatives. The community provides the platform for this. PSC activities based on the goals of Health for All is organized for individuals, families, and communities and managed within the wards and local governments at this level. Operational support by structures and institutions at the district local government level. The structures and institutions at the district GA level provide overlapping operational support. It is at the local operational level that all resources are put for implementation of primary health care. And like I always say, you cannot be in Abuja and think you can run primary health care. This operational support is so fundamental that you cannot overlook it. This is the most important level that we ought to provide the support to improve and strengthen the management and the operational capacity. There is the technical support by structures and institutions at the intermediate level. The structures and institutions at the state intermediate level provide overlapping technical support to PSC operations at the local government level. It is at the intermediate level that technical options are selected. That is at the state level. This is where they are adapted and applied to primary health care at the local government levels. Strengthening strategic support by structures and institutions at the national level. National level is important. This is where there are structures and institutions that provide overlapping strategic support for PSC operations. It is at the national level that strategic choices are made for national policies, for national priorities, for national strategic plans, organization and management improvement, health management information system, etc. Why the need for framework? The framework is designed to help ensure that at all levels, other health-related sectors, private sector, development partners, and academia will assist in strengthening health services. It is also necessary to help in resolving basic issues, reviewing health policies, and structuring services with a view to making them people-oriented. It is also important the framework ensures adoption of organized framework involving community-based activities within the health districts, LGAs, as operational units, and organizing appropriate support for them at higher levels. It also provides appropriate organizational structure for health and socio-economic development with the support of external technical cooperation and through people-to-people cooperation. It also helps people, the government and partners share responsibility for achieving health for all and result in overall improvement in health and socio-economic development. Thank you very much for your attention and God bless. Amen.